My name is Dr. Aviral Mathur. I am President of FORDA, Federation of Resident Doctors Association. I am a senior resident third year in Maulana Azad Medical College, Delhi, which has been my environment throughout my medical education. I would like to begin by showing my gratitude towards respected chairman and all the dignitaries of the dais for giving us this opportunity today to come and present some issues which directly are related to mental health issues of residents and students across the country. So, in our multiple communications with your esteemed office, we would like to continue from the point that was last being discussed, which is the bond policy. So, we understand through various judgments, at least Supreme Court and various high courts, that bond policy is a very difficult thing to eliminate completely, because the state has a moral constitutional obligation for public health. We don't feel and we don't think that it will be easy to eliminate bond altogether. But what recently in the last 1 year we have been suggesting, and we now, since DRP has been in its first year and has completed in many institutes, we feel that DRP can be laterally integrated into the bond service. With the advent of District Residency Program, there is always one resident present in every district hospital at any cross-sectional event of time, sir. And we feel that since bond policy also caters to having doctors available in peripheral locations, DRP is basically substituting that. And therefore, DRP can play a role in at least bringing down the bond policy durations and the penalty amounts which vary across various states. Moving forward, sir, I think one thing which always is overlooked upon is a risk other than the for the postgraduates. So postgraduates during their training face a lot of training, both in terms of mental and physical health, many for sick, many for pain, daily diseases that they are facing. In only our institutes, only recently there was an issue of dog bites happening to residents who were on night duty. One of the resident doctors, while getting human immunoglobulin because of A3 bite, suffered an anaphylactic shock, had to be admitted, had to be treated, and the bill was quite large. So, sir, what we have been saying in this is that this hazard allowance, similar to the schemes of CGHS and DGHS, which has been provided to all other permanent employees, if at all, it can be covered for the residents, because this will go a long way in for making it fortifying it in their beliefs that the institute and the government is taking care of them, lest they should fall sick during the duty line. Again, sir, moving forward, we feel that one issue which touches us as senior residents and of course has been a pivotal part of our medical education is the contractual posts. Contractual posts add a lot of mental stress to the working senior residents and junior faculties. Since we are also discussing about faculties, I am sure there will be representation, but eliminating it or increasing the tenure of existing ad hoc posts. In many institutes, even in Safdarjung, such a prime institute, there is an ad hoc tenure of only 44 days. 44 days is something, sir, which feels like an insult once we are filling the application form. So I feel, one thing which can be touched upon is increasing the number of contractual posts, and also if there are existing ad hoc posts, then increasing the tenure of the ad hoc posts. Coming to the recent PGMER guidelines, which were recently introduced, it was a long-pending demand that further amendments be made to that scheme, and we are very thankful that a new scheme was launched. So we feel that the original residency scheme, when it began in 1992, there was a clause in the original scheme regarding the leave entitlements. In that, it said that a JR would be given 30 days in the first year and 26 days in the second and third. Thereafter, in many amendments, the last being in 2018, the section dealing with leaves was completely removed. It wasn't there in the last scheme of 2018. This was the original scheme of 92. And now in the recent scheme, it has been given a duration of 20 days in addition to 1 week off and 5 medical leaves. So we feel, sir, that 20 days, although we are very grateful that a number has been specified with which a resident doctor can raise a voice in the department, we not be given that. We feel that the number of days at least should have been kept concurrent to what it was there in the original schemes. Something to ponder upon. Moving forward, sir, something related to leaves is the uniform salary issue. Many of my colleagues here, many of my juniors, they always, there is a lot of mixing happening in the across various states, because some states are paying good, and the student, by filling choices, has to weigh in and balance the scenarios of pay and the scenario of want, and then he has to strike a balance and then choose a college. So not just the reputation of the college determines where he is going or his interest in the branch. There are other issues like salary and want which determine that decision. And it goes a long way, decides his complete life. So we feel that a minimum salary structure be defined. I know it is a state subject and there is very little that central bodies can do. But of course, we are living in times where even post-doctoral students doing internships are getting paid only 15 to 20,000 rupees a month, and they are catering to the same patient load. So, which is again very sad and uncertain, sir. Moving forward, sir, few issues I just touch upon briefly is that as we were apprised by Honorable Secretary, Mr. Srinivas, Dr. Srinivas, that there is an application that NMC is trying to build, an application for mental health where there will be a grievance portal for the students, for the faculty to register their complaints, and we feel that it is a very nice idea. We know that it is still under consideration, but we feel that it is an idea that we should really focus upon, and if at all it is in the pipeline, sir, we would appreciate that it comes out soon, and it comes out very strong, because it might change things, sir. It might make the authorities liable and answerable at a very, very basic level. Again, sir, one issue which we have been getting complaints about is the biometric attendance system. The biometric attendance system for residents is something which we also feel in clinical subjects is bordering on absurdity. Because a resident doctor does not have defined hours, sir. As Honorary Chairman already remarked that some minimum hours are defined, the maximum capping of the hours has not yet been defined. And therefore, there are no certified times of getting in and punching out. So if biometric attendance, I know it is being done in good faith. There are reasons that it has been implemented, but there should be ways that should be discussed around this to implement it in a more holistic manner, such that people don't feel that, because then they will ask for the duty hours to be registered. One aspect that we have seen that they will want the duty hours to be fixed there. Again, sir, as ma'am remarked about the mentor-mentee programs, I would give the example of my college itself, sir. In my college, it's a very nice approach. But what we feel is that students in first, second year are so scared of their faculty members that although they have been allotted students from each year, one thing which has happened in my college we have been trying to address with the respective dean is that the contact numbers are not biometrically exchanged. The student has been given the contact number of the mentee, but the mentor has not been provided the contact number of the student, which I again feel curbs reaching out. And of course, students are very much scared. So there should be, in addition to the mentor-mentee program, I think institution, it should be happening at institutional level, but there should be sessions where it is organized in such a way that students can freely communicate and relate to the faculty members. Because it is a deterrence. It is a very good step, but sometimes it is a mental deterrent for the student to reach out to the faculty member he doesn't know or yet has interacted with. I have already spoken enough, sir, but just by highlighting, in my 14 years of being at NMC, sir, I have seen that only in the last year, within a span of 1 month, there were 2 suicides which happened. This was the first time that I heard such a travesty in my institute, and overall, in the last 3 years, there have been 4 suicides. These are the suicides which somewhere we can attribute to the academic, academic factors did play a role. So we feel that, sir, whatever decision the task force decides, maybe it helps at the grassroots level, because NMC being one of the pioneer institutes, if things are bad there, we can only imagine that how things would be at other peripheral institutes. Thank you so much for giving me the platform and time to speak. Thank you.